My name is Tanya Blanchard. I am a medical records coder. I code ambulatory outpatient surgeries at Brooke Army Medical Center. I was on vacation with my husband. I was with some family members. We were joking around. My brother-in-law did a little tap push on my shoulder and I jerked and felt, the pain instantly. Felt it in my left arm and it radiated down my left arm. It made the rest of our vacation very unbearable. I had a pain that radiated down my left arm. I could not turn my head to the right. I just felt in a lot of pain. I mean, it's really hard to describe that level of not being able to, put a shirt on or not being able to sleep because you can't lay on your left side because of the pain is so intense. I got back down here to Texas and I happened to work at the time with Dr. Anderson, who happened to walk in, and because I could not turn my head to the right, I had to turn my whole body to the right to see who it was. And he noticed right away that something was wrong.
Tanya was a patient of mine. She presented to the office and she was miserable. Her spine exam demonstrated weakness in her left upper extremity, which was consistent with a cervical radiculopathy. Her MRI confirmed the presence of a large cervical disc herniation. We also discussed the fact that she was a smoker, and I emphasized how important it was for her to quit. When I talk to patients, I always try to be as conservative as possible, but sometimes the conservative approach is the surgical management. With the clinical presentation of weakness on her examination of her left upper extremity or the risk of severe neurologic decline, surgical management is sometimes the best answer, and so I offered her surgery. She had an ACDF at the C5-6 level, which is an anterior cervical discectomy infusion.
If anybody has any kind of spine issues, they should go to Dr. Anderson because he is just phenomenal. He's compassionate, he listens, he's knowledgeable in what he does. He sees things that apparently other providers don't.
Whether you're a weekend warrior or a competitive athlete and you find yourself with a neck or back injury, broken bone, or just after years of wear and tear and need a total hip or total knee replacement, no matter what, if it's broken, it needs fixing, I've got your back.